Hello, my name is Dr. Bandoji, and I will be speaking to you today about diabetes and foot care. We all know that diabetes is a disease that stops a person from making enough insulin to control their sugar glucose or glucose levels or sugar levels. Without proper care, this disease can cause foot problems. These problems include foot and lower extremity infections, foot ulcers, narrowing of blood vessels leading to gangrene, nerve damage. Unfortunately, these things can cause foot problems that lead to amputation. People with diabetes are more likely than others to have problems with their feet, especially when glucose levels are not well controlled. These problems can lead to dangerous infections of the foot. How diabetes can affect the foot in two ways: cause nerve damage and loss of feeling, cause narrowing of the blood supply and gangrene. Diabetic neuropathy affects the nerves that supply sensation to the foot. Contributing factor to the development of diabetic foot ulceration is peripheral neuropathy, sensory neuropathy, motor neuropathy, and autonomic neuropathy all go under peripheral neuropathy. Sensory neuropathy is damage to the nerves that make us feel pain. Motor neuropathy is damage to the nerves that move the muscles. Autonomic neuropathy is damage to skin that causes dryness and cracking. Ischemia. Ischemia is the narrowing of blood vessels causing decreased blood flow to the feet. When the blood vessels are narrowed, less blood and oxygen reach the feet, delaying the healing of wounds. The pain it leads to is also called ischemic pain. And this is caused by less blood supply, which causes ischemic pain, and gangrene due to loss of blood supply. So, to control blood glucose level, take care of your feet daily and inspect the feet for signs of infection every day. As you can see in the picture, if you cannot see the bottom of the foot, please use a mirror. Look between the toes, because sometimes fungus can develop between the toes and it can lead to ulcerations. Check for any cracks, blisters, or redness or swelling, because these can be dealt with at an early stage and can prevent ulcerations and infection and later gangrene or amputation. Wear proper footwear. Do not wear tight or smaller than your foot as footwear. Make sure that there's plenty of room for the toes. Definitely do not walk barefoot, even inside the house and even on carpets. If you cannot see the bottom of the foot, use a hand mirror, just like in the picture. Apply lotion to the feet daily, but not between the toes, so you do not develop fungus between the toes. Visit your healthcare provider regularly. Footwear. Wear appropriate shoes. Avoid tight and high-heeled shoes. Avoid open-toe or open-back shoes to prevent possible injury to the feet. Always wear clean socks and change them every day. This way you can inspect to see if there's any traces of blood that may be from ulcerations. Avoid tight socks as they will restrict your blood flow. Preventing injury to the feet. People with diabetes should take extra precautions to avoid injuries to their feet. Never walk barefoot, even on the carpet and even inside the house. Check the inside of your shoes before putting them on, just in case something is inside the shoe that may cause an ulceration that you will not feel until after it's too late. Avoid contact with hot water or surfaces, because you cannot tell how hot the water is and you can cause a burn in the feet. Always check the water with your elbow. Before washing your feet, check the water temperature. Please do that with your elbow, not with your foot. Avoid exposure to the sun without the protection of sunscreen lotion, as people will cause as the sun will cause blistering and burns to the feet when not protected. Regular checkup. Check with your healthcare provider regularly. Have an annual foot exam, at least if you don't have any problems. If you have problems, every 3 months is preferable. Don't remove corns by yourself or use your nails or fingers to do that. Please come and see the podiatrist to do that. When found early, foot problems can be treated. Thank you very much for your attention, and I hope this was helpful.
Good morning, everybody. This is Dr. Abdul Muttalib Al-Masloum. I am one of the vascular surgeons at Johns Hopkins Aramco Healthcare, and I'll be talking to you today about diabetic foot, the role of vascular and blood vessel surgeon. Okay, let's start with the definition of diabetic foot. As we know that diabetic foot does not stand for a single entity. It is actually a complex of pathologies that affect the foot in diabetic individuals. Why they're grouped under one name? Because most of the time the consequences are similar, and also the way of managing is more or less the same. You'll find part of my presentation crisscrossing with other presenters, and that's for better understanding, and also because of the nature of the diabetic foot. It's handled by multi-specialty, including wound care, podiatrists, vascular surgeons, interventional radiologists, and many other medical teams. So one of the most leading causes of loss of function of the feet and lower extremity is diabetic foot. And it's multiple defects, including defects in the foot, toes, nails, and any of those in diabetic individuals. Cracks and fissures can also be classified under diabetic foot. Traumatic ischemic ulcers, that means there is also lack of blood supply, also wounds, infection of the soft tissue or the bones, infection of the skin, and also dysfunction of the nerves. If you could see these images that represent 2 or 3 types of diabetic foot, as the left side and the middle pictures are depicting gangrene, which is dead tissue at the toes and also at the heel. The right side image represents the lack of blood supply and initial side of it before gangrene develops. What are the risk factors of diabetic foot? No presentation is complete without understanding the risk factors, and also how do we handle those before we go to the treatment. So any history of previous diabetic foot, which means that risk factors are already established. Loss of protective sensation, which happens in about 80% of diabetic individuals over time. And that's due to the effect of diabetes on the blood vessels that supply the nerves. Therefore, the nerves of different kinds, those sensing the temperature or sensing the pain or the position, as well as those nerves which supply the skin appendages, including oil glands, as well as sweat glands. That's why diabetic feet tends to be dry and on the side of cracking and having fissures if they are not well taken care of. Also, pre-existing diabetic foot deformities, including bunion, including trauma from the past, as well as blood vessel disease. We know that blood vessel disease is precipitated by long-standing diabetes mellitus due to the effect of diabetes on the inner lining of the blood vessels and damaging the cells inside the blood vessels, leading to shrinking and narrowing or even total occlusion of the blood vessels. So the prevention is also essential in understanding. One more important factor is smoking. Smoking with diabetic foot, they don't go very well. That's why it's highly recommended for individuals consuming tobacco or any other products of smoking to quit as soon as they can in the initial step of management of diabetic foot. Of course, Daily foot self-care is the essential cornerstone in diabetic foot care and management. We depend on the individual taking care of themselves. Of course, they have to do the examination with the aid of their family, or sometimes they can use other aid individual measures like mirrors or cameras placed at their feet so they can look underneath them. They have to know what is the level of sensation, if there is any change in it. So they have to know if they are not sensing the ground when they step on it, or they're not sensing the sharp items. That's why they need to be very cautious. After that, we'll talk about the prevention as well uh, by wearing the special wears for the feet. Also, they have to look consistently and about for the any skin changes, including cracks, wounds, ulcers, and they start to manage them early on. They have to know the temperature of their feet. If they are changing, they're becoming cold, or they are warmer than usual. Also, if there is any color change, they have to keep a track of that one. Also, one of the duties of diabetic individual in taking care of their feet is to schedule a regular examination with their clinical doctors, not only for the feet, but also for other systems, including the eyes, checking the kidney function. And each diabetic individual has his own particular follow-up. Not everyone should do the same, but there is a general care. Of course, they have to monitor the diabetic control. Foot hygiene includes to avoid excess moisture, like fluid moisture, water between the toes, trimming the nails in nice, good way, and filing the sharp edges, cleaning and drying the skin, and moisturizing at the same time. As we said that due to the effect of long-standing diabetes on the nerves, the skin tends to be dry. And also wearing the protective footwears, like shoes, are covered from the front and the back, and they are not permeable to simple items that can cause injury. And very important for diabetic individuals is not to walk barefooted. It's really essential to always have something, even when they are inside the house, under their feet, and avoid stepping on items that they cannot feel and that can cause injury unnoticeably. So our roles as vascular surgeon, as well as vascular surgery team with our colleagues in interventional radiology, is coming from the restoration of blood to the foot whenever there is a damage or there is an infection or there is an ulcer. And why we do that? Because the earlier we do it, the better chance for the wounds to heal. If there is, of course, a problem in the blood supply. So let's talk about foot ischemia. Foot ischemia happens when there is not enough blood supplied to the foot because the blood vessels are not capable of doing it. And we know that the blood carries the oxygen necessary for new cells to form, and that's the healing tissue, and also the nutrients that support that process of healing. Tissue always needs oxygen and nutrients while fighting infection, while healing the wounds. In case of ischemia or lack of blood supply, there is, of course, the opposite. There is no enough oxygen, there is not enough nutrients. The wound tends to become worse and worse over time, and actually full gangrene can happen, which is complete death of the tissue that's left without good blood supply. So our role is pivotal as well to the role played by other care individuals. We share them, the care together. It's a multidisciplinary care approach for diabetic foot handling. Our primary goal, however, is to restore the blood circulation to the limb that is suffering an injury or suffering actually ischemia because the blood vessels are interrupted. And our main goal here is to preserve the limb and keeping its function, and of course to preserve life. And we'll talk about this a little bit more later. So as mentioned earlier, diabetes is slowly damaging the blood vessels from inside with the process of accelerated atherosclerosis because the blood vessels become really tough. They're not versatile. They not allow the blood to flow easily and smoothly. And of course, there is an inflammatory process caused by diabetes. And it's more complex than just explaining it here, but it is well known and documented by medical science. That will lead to what? It will lead to narrowing of the blood vessels, or sometimes complete interruption and occlusion, which will reduce the amount of blood circulating to the end of our limbs, like to the feet, to the toes. And that consequently will reduce the amount of oxygen and also nutrients delivery. As we mentioned, wounds need a lot of blood to heal. So if there is not enough blood, not enough oxygen or nutrients, the wound healing will become slow or sometimes deteriorated, and that can allow infection to become worse and worse, and therefore we can suffer loss of the affected organ. So does every patient needs to see a vascular surgeon or to have a vascular procedure with diabetic foot? Of course not. However, many patients will benefit an early intervention by vascular team. When you come to a vascular surgeon for the evaluation of diabetic foot, they will first of all evaluate the clinical situation of the patient, and they will assess the risk factors that are already being affecting the patient and the blood vessels. And part of our clinical assessment is to do the examination of the pulses in the upper extremities, pulses in the groin, pulses in the feet. And then we will conduct special tests, including a Doppler examination. We will listen to the blood running through the blood vessels. We cannot feel the pulse with our fingers. And we can conduct also ultrasound examination to see the inside of the blood vessels and how badly narrowed or if they are actually occluded. We can do a CT scan with contrast material injected in the vein that circulates in the body, and which will enable us to decide where is the problem in the blood vessels and how big is that problem, what's the extent of it, and is it remediable or not. In addition to other imaging techniques, including magnetic resonance imaging and also direct angiogram, where a needle is stuck in one of the arteries and we inject the contrast directly into the blood vessel, and that will give us a good map of the vascular tree. So the vascular surgeon, once done these tests, he will sit with colleagues from interventional radiology and other colleagues in multidisciplinary group, and we will interpret those tests and try to see where is the defect and how can we help this individual. Of course, we'll advise certain interventions as needed. So the interventions could be as simple as just medical treatment. You take an aspirin, you take other blood thinners, and wound care and watching the patient. Maybe the intervention will say, okay, we need to open a narrowed vessel or a completely occluded vessel. And that may be doable using a wire and a balloon technique. We call it angioplasty with minimal approach. Or it might need a surgical opening of the artery and the removal of the inside narrowing and then sewing the artery in a way that will enable the blood to flow much more smoothly. Sometimes we need to do a bypass because that blood vessel is completely damaged and there is no point to using it again. And the bypass can use the patient's own veins from his body, or we can use synthetic tubes, like form of PTFE material, or we refer to it as plastic tubes. And of course, wound care and sometimes amputating the dead parts, including the toes, sometimes the foot, is part of the management of diabetic foot. If you could see here, I'll use the cursor. This is a normal angiogram, and it shows at the knee level here that the artery is smooth. You can see the white thing is the contrast within the artery, and it's flowing into three small arteries there, one here and the last one here, and they go all the way to the foot here. At this individual here, there is a complete occlusion here behind the knee. This artery is called the popliteal artery. Therefore, if this happens acutely, of course, if nothing done, the whole leg will be gone. And let's say this individual has one of those three vessels. You look at this vessel here, It is here, but it is interrupted here because we cannot see it anymore. This middle vessel is still there, but it's helping by sending a collateral branch. And the other vessel, which is the third one, if you can see it here, is gone in this individual. Okay, so that individual we saw earlier with occlusion of the popliteal artery, he had an angioplasty here, okay, and the angioplasty has helped to open the damaged blood vessel and restoring the circulation in a better way. This is an example of a surgical bypass. So if the balloon and the wire technique are not enough to restore the blood vessel integrity, surgeons may decide to open the artery and remove all the calcium products and the narrowing from the inside the artery and sewing it again to make it quite open. Or they may choose to do a bypass, whether using the patient own vein as a tube bypass or a synthetic material as a bypass here. As I mentioned, amputation is part of the treatment. We refer to it only when there is dead tissue that is not anymore salvageable. So you can remove the toes, and that will give a better chance preserving most of the remainder of the foot. Sometimes we lose the battle with diabetic foot, and we have to lose the foot in order to maintain the remainder of the body and to let life continue. So we go to a higher level amputation, whether it is below the knee or sometimes above the knee. So my home take message to all of you is that prevention is worth 1,000 intervention. We have to accept the current facts that diabetes is very harmful disease and is slowly and progressively damaging the inside of our vessels. And we will tend to see those complications in the future as time goes. However, we can control how fast is diabetes doing this by aiming to the best control from early on once the diagnosis of diabetes mellitus is established in the individual. Also, to remain active as much as the person can, because that's the way where your body functions and restore its ability to heal. To abstain of additional harm like smoking, and also to be diligent in finding your self-care, taking care of your feet, taking care of your health, seeking early treatment and not waiting until it is too late. And we have to accept the fact that some individuals will come to an end-stage disease where something needs to be done. This could be restoration of blood circulation, or it could be sometimes an amputation. And therefore, when of those happens, then we have to adapt to the new changes and trying to gain a new function and enjoy life again. By this, I conclude my presentation. I wish you all to remain healthy and happy.